Good evening, sir.
Yeah, good evening, Andy.
Good evening, sir.
Good evening. Can you all see the screen?
Yes, sir. Yes, sir.
Yes, sir.
Yeah. So do you remember in the last class we were discussing about different models of counseling, right?
Yes, sir.
And I was telling you in yesterday's session, we were going to discuss at length or in detail about Egan's model of counseling. Okay? And Egan has given a three-stage model of counseling. Can anybody remember? Can anybody tell me what are those three stages? What are those three stages of Egan's model of counseling?
Current scenario.
Yes, current scenario. That is what is happening right now.
Yes,
Yeah.
sir. Preferred scenario.
Yeah. So what that mean? What does that mean? Preferred
Possible.
scenario ante?
That is possibility, sir.
Yeah. So like basically preferred. What are you preferring? Like where would you like to go?
What
If
we
it
need
is
to do or what we need to achieve.
yes, like more than that, like I am here, but the reason I came here because I want to go there. I don't want to be here
Yes,
in
sir.
current scenario. So I want to go there. That is preferred. This is what my preference is. So as a helper, you are going to help them reach from this place to this place. Okay, that is where third stage comes. That is action phase. Okay,
Yes, sir.
is
Yes,
it
sir.
clear? So there is current scenario, preferred scenario, and the action phase.
Yes, sir.
Okay, and each phase requires a different set of counseling skill.
Sir.
Okay, each phase requires different set of counseling skill. So in the next slide, I'm going to give you the list of all the skills probably that are used as part of Egan's counseling and for that matter, any other counseling models as well. Okay, so they are basic to counseling process. Okay, so the list of skills that are used in Egan's model of counseling are, yeah, so attending skills, listening skills, empathy, the way you probe, you summarize, the way you challenge. Then there is a second level of empathy, which we call advanced empathy. Then there is also a place for education or information sharing wherever you feel it is helpful. Then there is confrontation, then self-disclosure. Okay, as a counselor, you can talk about your own self, not indiscriminately, but if you think it is helpful for the client. Okay, and immediacy, which is very, very important in any practice, not only in counseling, in any form of therapy, immediacy is very, very important. Then encouragement, that is supportive responding. Then we have seen yesterday goal setting, brainstorming, crave analysis, which are usually used in the action phase. Okay. So
Sir.
we have seen three different kinds of phases, right? So I probably even before those phases, there is a phase called pre-helping phase. So before you even actually get into helping, there is a pre-helping phase. Okay. So that's where you develop probably rapport. Okay. So now I'm going to present all these skills in phase wise. Okay. I'm just going to quickly move from one slide to another slide because we are going to talk about these things at length in the coming slides. Okay. So in pre-helping stage, we use we need to know like when a client first comes, like how are you going to introduce yourself? How are you going to welcome the client? Okay. So because the client's impression of you or the formation of the relationship begins in your first meeting. So that is why even this is also very, very important. Okay. It reflects your attitude towards the client. It reflects, it gives some impressions about your personality to the client. So nothing can be ignored. It's not a usual relationship, it is a professional relationship. Okay. If it is not different from usual relationship, then probably it is of no use. Okay. But it doesn't mean that some people in usual relationship, they don't exhibit these skills. They do exhibit. In fact, all these skills, they did not, what do you say, they are not born out of any context. All these skills, they're actually observed from day to day interactions only. But those interactions which were helpful, those interactions were taken and they were analyzed and understood. Okay, these interactions between humans were helpful because those interactions had these skills. So that means counseling skills are not specific to counseling. They are actually part and parcel of life. And actually, they should become second nature to us. They should be part of our day-to-day life as well. When we talk to our spouses, when we talk to our children, our friends, our students, it has to be part of our day-to-day life. Otherwise, you cannot just act these skills in counseling process if it is not part of you. Okay, these are good interpersonal skills. Okay, it it has to be developed. Okay, so the pre-helping phase probably involves welcoming and any idea what is solar means?
No, sir. No idea of it.
Sir, it
Okay,
is
so
an stand
yeah, go
for
ahead.
the sit towards the client and observe open posture and listen and
Yeah,
empathy and relax.
okay.
Empathy
So,
and relax.
some of them are correct, but we will anyway uh, have a look at it. But anyway, good try. Okay. Uh, yeah. So we'll go to stage one. Okay. So stage one is what is the current scenario? What's going on? Okay. What are the skills that are used in this stage one? We have seen these are the core conditions of counseling in our first class, right? Genuineness, concreteness, and unconditional positive regard is something that we have seen. But in this probably session, we will talk about empathy. Okay. So counseling skills that are most useful in the stage one when you are exploring the client's story or trying to find out what the real issue is. Okay. So what is helpful? All these skills are helpful. Okay. And when you move to the second stage, okay, like what is my preferred scenario? Where would I like to go? What are the possibilities? That's where you need to use something called advanced empathy, self-disclosure, immediacy. Again, we are going to talk at length about advanced empathy, basically empathy, advanced empathy, immediacy, confrontation, and uh, uh, challenging. These are the things that we are going to look at in detail. And probably, if time permits, we would also practice it. Okay. Counseling skills in stage two are these things. And then in stage three, where you are basically looking into like developing some action plan to help clients move from stage like preferred scenario, sorry, current scenario to preferred scenario. Okay. Yeah. So in counseling three, we use brainstorming, SMART, goal setting, crave analysis, force field analysis. These three we are going to look at at length. Okay. And contract with the self. Basically, contract with the self is committing that I'm willing to practice these things, or I'm willing to engage in these actions continuously, persistently, even after the counseling is done, counseling process is terminated. Okay. The next thing is conclusion and termination. So usually people don't pay much attention to termination because lack of proper termination itself can become a reason for various other psychological problems. I'm not just talking about in the area of, let's say, in the context of counseling, but if there is no proper closure for us, like for example, in any situation, we didn't say proper goodbyes to friends, or like, so those kind of situations, we have something unresolved baggage. So that is why planning proper termination, planning ahead, discussing with the client, all these things are very much important. Okay. I know a client, a teacher who left one college and where she did not get to say goodbye properly, and even the college people also, school people also, they could not, they did not get time to say goodbye properly. But she developed some unusual problems. Okay. But later in the exploration, it was found out that it was because that she still has those, like, that lack of proper closure, proper ending to that particular assignment of hers. So when we arranged for that, when we decided to do that, and when she went there and she met and said proper goodbyes, all those symptoms were relieved. Okay. So we cannot neglect the termination process as well. Okay. This is very, very important. Okay. Is it clear till now?
Yes. Yes, sir.
Yeah.
Yes, sir.
So next we are going to look into something called attending, basically visibly tuning in. Okay. That is letting the person know that I am attending to you. Okay. So that is visibly tuning in. Okay. So like you need to like in visibly tuning in, you need to be aware of non-verbal behavior of yourself and of the client as well. Okay. This is very, very important. So like if you're talking to me and I look here and there, okay, I'm not paying attention, I'm not even showing any interest in my facial expression. Is it possible to not to show interest in your facial expressions, the way you sit?
It's not possible.
No, let's say you can open your screen once.
Sir, sir, it's not possible. But if you permit me, I will. My experience is, if the person is a born criminal,
Hmm.
he can do like that.
No, I mean,
Otherwise,
hmm.
otherwise, your body and your language, your facial expression automatically comes.
Okay.
That is what my
No,
experience
that's what
is.
I'm saying. That's what I'm saying.
Mm.
Your non-verbal behavior can indicate to the client whether you are really interested in what he's saying.
Yes.
Okay.
Yes.
If you are really not present, honestly not present there, you cannot fake it.
Yes.
Okay. So that
Yes.
that genuineness has to be there.
Yes.
Okay. That is why your non-verbal behavior you need to be aware of. You need
Yes.
to be aware at the back of your mind. You need to start noticing, how am I
Yes.
presenting myself? What
Yes.
kind of facial expressions I am showing?
Sure.
Okay. And at the same time, I also need to observe the client's non-verbal behavior also, because
Yes.
non-verbal behavior is a powerful medium of communication,
Communication.
right? Because sometimes client might be talking about very painful topic, but he's not showing any sadness. Okay. And probably on the top of it, the client is smiling or laughing. So that means there is incongruent. If you miss
Income.
this, if you just only listen to the client, but if you miss non-verbal behavior, you think whatever he is saying is true.
Yes.
You will miss an important aspect of the client.
Yes.
Okay, but if you notice it, you can gently let him know that, see, right now what you're talking is very painful topic. But I see that, I noticed that you kept smiling. Okay, can we talk about it?
Yes.
What is happening here? So just turning their attention, because they might be ignoring certain emotions, certain experiences. It might be their way of avoiding those things. Okay. So that is why you need to be fully present in a given counseling session. Okay. If you miss, let's say, even 4 or 5 minutes of what is happening, because you are so preoccupied with your own issues, or you are thinking about what is happening at home, you are missing an important source of information or important part of the information.
Yes.
So that means you need to be you need to be genuinely interested in client, and you need to have that respect for the client. Okay. And I have done a lot of couple therapies, right? And in couple therapies, usually what I do is I talk less, I let them talk more. I facilitate their communication. But usually in practice, like if you go to a couple therapist, usually an elderly couple therapist, okay. I'm not saying younger people are doing, younger people won't do that. So what they do is they keep on giving lectures. So that's not helpful. You need to develop in them a way to resolve their conflicts. That can only happen if you help them talk and help them modify the way they talk. Okay. So I do one exercise with them. Okay. In that exercise, I make them sit opposite to each other. Okay. I assign send what do you call speaker's role to somebody and responding role to somebody.
Mhm.
Okay. And I ask the speaker to talk about an issue that is troubling them. Okay. And the speaker has to speak about that particular issue in a way the speaker is not blaming the other person.
Oh,
Okay. Like, for example, uh, I might say, like, if one of you is, let's say, imagine that you are my partner, then I would say, నువ్వు ఎప్పుడు ఆ స్టూపిడ్ ఫోన్ మీదనే ఉంటావు. ఓకే. ఇక్కడ నన్ను పట్టించుకునేవాడు ఎవడు లేడు. ఇక్కడ ఉండడం కంటే నేను మా ఇంటికి వెళ్ళి ఉండడం బెటర్. ఓకే. దట్ ఈస్ ట్రూ. అది జరిగేది విషయమే కరెక్ట్ గా ద వే యు ఆర్ టెల్లింగ్. అప్పుడు హస్బెండ్ ఏమంటాడు, నువ్వు ఎప్పుడు నా స్టూపిడ్ సీరియస్ లోనే ఉంటావు. సో వాట్ వైఫ్ ఈస్ ట్రైంగ్ టు కన్వే, husband is not able to receive because the way it was conveyed. Okay. Husband is also not trying to listen to what she is conveying. He is trying to defend himself. Okay. So in order to facilitate that communication, they need to find a way to communicate. For example, wife might say, see, I really love to spend time with you. I enjoy the time that we spend together. How is the start? How is the beginning? She's not attacking him. She's talking about something positive. Okay. And she's telling, see, whenever we talk, whenever we are together, when the phone becomes the focus, okay, I feel alone. Okay. I feel ignored. She's not saying you are ignoring me. She's not saying, I mean, she's not blaming by using the word you. She's saying how she feels. I feel ignored. Okay. And now she's asking, like, whenever we are together, if you can put the phone aside and pay attention to what we are doing, what we are talking, that would really mean a lot to me. I feel loved. Tell me, which is the place where the person is able to receive the communication?
Second one, sir.
Yeah, second one. Now, the important part here is responding part. Okay. Now the person is they immediately they have something in mind and they try to jump and answer. But what is happening is I was so busy. No, this is not what you needed to do as a respondent. You need to do first. You need to repeat what the person is said. Once you fully get what the person is said, then only respond. Okay, they have to repeat what the wife said. Then only respond. You don't believe I may have to take almost 6 or 7 repetitions before they get it correctly. Okay, that shows, means I understand from those things how difficult it is for us to listen. Okay, the thing that husband has to say, what you are saying is, you really like spending time with me and you enjoy that, but when we are together, when the phone becomes the process, you feel like you are alone. But instead of what you're expecting is that, like, that I you want me to give undivided attention when we are together, where it makes you feel loved. Am I right? That's what husband is supposed to repeat back. Okay. But to do this, some clients who take 6 repetitions, they miss some part of it. And a wife would say, no, you missed this. But there are wives who said, this is the first time you understood, you kind of understood me completely. So that is the importance of listening. Are you getting my point?
Yes, sir. Yes, sir.
That's the important. If you are not
Yes.
fully present, you will be developing your own defense in the mind even before you get what the person is saying. Okay. So it starts with attending, and you need to attend to non-verbal behavior as well. Okay. What is non-verbal behavior? Like even the non-verbal behavior, like how close they are choosing to sit to the counselor. Okay. Even when in family therapy we are trained to see where each family members would sit. Where would children sit? Where would husband and wife sit? Are they going to sit next to each other, or wife would sit at this corner, mother or husband would sit at? They all communicate something about them, right? So all this non-verbal behavior is to be observed. How they groom themselves. If they are not grooming properly, it tells about probably they are going through some depressive phase, right? That is why it is important to focus on non-verbal behavior. Okay. Okay. So all these things are very, very important to uh,
Good evening,
up.
sir. Sorry for the interrupt. My name is Chandrakala. Non-verbal communication, it is possible to understand 37% with the help of the body language.
Yes, yes, yes. Yeah. But again, not, I mean, that's what I'm saying, that you cannot miss that. You will not miss only if you are completely present there.
Yes.
Okay. You can think of, like, you all would have gone to some restaurants. Okay. You would have observed people who are talking to each other in a deep conversation. Okay. You can observe how they are paying attention to each other. Okay. Even though there is a lot of noise, but still they are able to pay attention to each other because they are genuinely interested in the topic that they are talking about. For example, if you are not uh, observing of, let's say, non-verbal behavior, let's say you are a teacher, you keep on giving the lecture, not even noticing how the children are taking,
Yes.
whether they are feeling bored or not. You are not even taking the signs of their non-verbal behavior. It is of no use,
Exactly.
right? Then again, probably sometimes you might say whatever you want to say without any non-verbal movements in monotone. Okay. Then you will think why it is not affecting, why is it not influencing other people? Because non-verbal behavior is not supporting what you're saying. You're not using your hands, your gestures. You're just talking. It's like reading. Okay. So like even not talking is also non-verbal behavior, right? Sometimes we give silent treatments to our partners, right? That is also communicating something. Even silence also says like something about what they are trying to communicate. So that's why non-verbal behavior is very, very important. Okay. And sometimes clients can misunderstand your non-verbal behavior. Okay. So like you need to be sensitive to clients' reactions to your non-verbal behavior. Okay. Suppose you're sitting too close to them. Okay. In the initial stages, they might feel threatened. So you need to be aware of their non-verbal reactions, and based on that, you have to adjust yourself. Okay. But again, don't be preoccupied with how I'm presenting myself. Then you will not be able to attend to what they are saying. Okay. You just be aware, but resist how you express yourself. When you are aware, that itself is enough. That will help you to reflect. Because sometimes clients might say something that might anger you. Okay. That might bring that anger in you. But don't immediately express. Just be aware of the fact. Notice how you're presenting that thing in the body. Okay, be aware that you are feeling angry, but take a moment to reflect on it. Don't immediately express it in your face.
Means we do not react, just we have to observe, and after that we can respond about
Yeah,
that.
reaction is without thinking, whereas
Yes.
respond is you thought about it. Okay, so
Yes.
now the idea is don't be preoccupied, just be aware, but at the same be at home with non-verbal behavior. Like if you're at home with your non-verbal behavior, you are not so concerned about how you are doing. It shows that you are at peace with yourself. Okay, it shows that you are stable person. You are more at peace with yourself. You are somebody who's mature person. Okay, as now that gives confidence to the client as well. So basically, your non-verbal behavior should enhance. It should not hinder the relationship. Okay, but the key point is this. Key point is you can learn all these things. Okay, but if you are learning it without any underlying attitudes, okay, it would look like you're acting. If there is no deep like respect and value for the client, what you show is just like action. So what is in your heart is very important, along with how you present yourself. Is it clear? So you need to feel that genuine feelings inside. How would you rate it if one's the worst and finds the best? So can you please switch off that, somebody? Yeah. So like there are other nonverbal behaviors, like all these things that are mentioned here, along with uh, even physiological response is also very much important, right? So they might be grinding teeth, and but maybe smiling and saying that I'm not angry, but still they are showing anger. So even physiological responses like increased breathing, okay, like changes in the breathing rates, and like they look like they are tightened. All those things indicate something about what is going on with them. Okay, so it is important that we focus on all these things. Okay, the next comes is solar. Okay, basically solar means, so this you can really understand if you can bring to your mind what you have observed in a restaurant between two people who are deeply involved in a conversation. Okay, so this is how you can physically present to the client. This is how you can physically show to the client that you are involved in what they are saying. So basically, squarely is sitting opposite to them. Okay, sometimes sitting opposite to them, making direct eye contact may be uncomfortable with some for some clients. Then you can sit at a slightly angled position. Okay, but again, you need to uh, lean toward other. Like, see, squarely basically means you are showing you are involved with the client. Okay, you are looking at them. Okay, open posture basically means that you are not defensive. You are open to what they are going to say. You are available to them. So open posture means you don't cross your hands, you don't cross your legs. Okay, that is what open posture is. Then you lean to the extent possible. Like if you see in conversations in the deep conversations in the restaurants, when they're involved, they are actually slightly leaning towards each other. Okay, they might be making eye contact with each other. Okay, they are all indication of the fact that you are really interested in what the client is saying. Are you getting my point? You are interested in what the client is saying. But again, all these things are to be done in a not in a mechanical way, but in a relaxed posture. Okay. So if something that you are trying to practice, you might not look like you're relaxed. If you're am I sitting square? Am I being open, or am I leaning toward? If that is your consciousness, probably you might not look relaxed. So if it is something that you practice in your day-to-day life with whomever you are communicating, whomever you are listening to, that would become part of you. Then it becomes very easy for you. So if somebody who is not like having these skills in your day-to-day interpersonal relations, Okay, it is very difficult to bring them to and act them in the counseling situation. So we have to make them part of our day-to-day situations. When our children are talking to us, we don't even have patience to listen to them. You cannot just bring patients directly to counseling situation. We need to even practice them outside as well. Okay, like trying to listen to fully what the other person is saying, showing interest in what they are saying. They are all very important. There is very interesting study. Okay, uh, I think a person by name Pentland, 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 in 2008 and 2009, he conducted some studies where he says honest signals are hard to fake. Okay, honesty is hard to fake. So if you are honest, it does come out, and it does influence the person. Okay, so that means if you are honest from within, it is easy to be present with the client. Okay, this is a significant finding. There are books that are written on honest signals. If you can just type it in Google, honest signals, you will find it. Pentland, Pentland, Pentland 2008 and 2010 has done the research. So this is about showing the clients that you are attending. Okay, that you are attending. Now, next thing is listening. Okay. Now, let's say imagine that you are my therapist. Okay, you are my counselor. I'm trying to tell something that happened. What are you going to focus and what are you going to listen to? Do you have any framework? What should I focus on? What should I listen to? You need to have some understanding of what framework should I have. What should I listen to? What are the different components of whatever the client says? Like for example, if I say this, let's say for example, this is taken from Egan's book. Like for example, a client says, uh, toward the end of the day, my boss shouted at me in front of some of my colleagues for not landing an order from new customer. I lost my temper and yelled right back at him. He blew up and fired me on the spot. He removed me from the job. I really think he's an idiot. The company should not tolerate people like him and in supervisory positions. And now I feel awful, and I'm trying to find out if like if I really have been fired, and if so, if I can get my job back. I have every intention to fight this. It is not just, it is not fair. Okay. What are the different things in what I communicated right now? Okay, I think I have a slide on this. Let me just, maybe you can read it for yourself. Now after this, I'm going to tell you what you need to look for. Then it will make much more sense. So that means when you are listening with an intent to understand. You intend to pick up certain things. Okay. Because your intention is to find out what can help this client. Okay. What is the problem? What can help this client to use his unused opportunities to move from current scenario to preferred scenario. Did you all read this?
Yes, sir.
Okay. So now you need to look for, let's say, like experiences. What is the experience the client is narrating? What experience? Okay. You need to look for feelings. You need to look for behaviors. Okay. You need to look for thoughts or point of views. Okay. So what is an experience in this? What are emotions in this? What are behaviors in this? Or what are thoughts or point of views in this. You should be able to differentiate that.
Anger is the emotion.
Good. That when the client is saying, I lost my temper, that is anger. Then what is the behavior?
Yelling at right
Yeah,
back.
yelling right
Aggressive.
back at him is a behavior.
Aggressive.
One
Aggressive,
wonderful.
sir.
Yeah, aggressive. That is behavior is in that narration. I yelled right back at him is my behavior, right? And what
He,
is
he felt he was insulted or inferiority or insecure or
no. You just take statement from whatever is presented. Tell me what you're talking about. Like he's saying, I really think he's an idiot. Okay, that is his thinking, and his point of view is the company should not tolerate people like him. That is his point of view.
judgment about someone.
So that is how, like, that is his view, his point of view. One is his thinking, that he's thinking he is an idiot, and these kind of people should not be there. That is his point of view. So you should be able to differentiate. You should be able to think. And there is also a resolve, an intention that he has in this. What is that?
He
I want to
felt
fight it. I have every intention to fight this. Like in this small thing, there are so many things that you can observe, right?
yes.
Yeah. So it's not just if you just sit there, it doesn't help. You need to listen with an intention. You need to really show interest in helping the client. You need to have that in your heart that no, I want to help this client. I want to be there for this person in full way. So we listen to thoughts, individual thoughts, and we also see thought patterns. We look at behaviors, we also understand behavioral patterns. Okay. Like for example, one thought pattern can be pessimistic style of thinking, thinking that everything is going to go wrong. If those thoughts are persistent, then you okay, this is what the client has been doing. This is something that is probably not helping the client to move ahead. So you are arriving at a understanding of thought patterns. Then you see, even when there are opportunities present, client is not engaging in those opportunities. Client is avoiding anything that is causing little discomfort. Client is showing a tendency to avoid it. Okay. Then if you see that across different contexts, then you are trying to understand. Okay, there is a behavioral pattern of avoidance. Probably this client is trying to cope with difficult emotions by avoiding them. So they are giving clues into how you can help them later. Now you are trying to get to an understanding. See, many people would share experiences. It is good and it is important to listen to experiences, but experiences alone are not complete. Most of the times they are not complete. Usually experiences are like what other people did or what other people failed to do. Okay, experiences would usually involve that only. And there is a kind of victim mindset there. Okay. But along with experiences, you need to explore all other things as well. Okay. So in thoughts, when we say thoughts, we explore point of views, we explore intentions, we explore the decisions, the decisions that they declared or the proposals that they made and the plans that they are trying to engage in. So they are all part of the thought processes. Okay. So they give clues into why clients fail to manage their problems. when you are listening for these things, they start giving you clues into why clients fail to manage their problem situations. Okay. So, like somebody, like if you see, always they are passive, like they are in a victim mode. They see everybody is like this. I can't do anything about it. They are doing this to me. He is doing this to me. They are in a victim mode. Okay, nothing can be done about it. So when their way of looking at things is passive, they see themselves as victims. They won't be able to manage the problems. And sometimes this complaining and victim mode is used as a way of avoiding responsibility. They are not willing to take the responsibility. They want somebody to come and rescue them. So they are all indications. You're making note of all these things when you're listening to them. Okay. Otherwise, we won't be able to help them. We don't arrive at what is the real problem. So as I said, uh, clients fail to manage problem situations because they are passive and see themselves as victims. Okay. And they use sharing these experiences a way of avoiding their responsibility. When they are too much of sharing experiences, they are basically avoiding responsibilities. So sometimes there might be true in what they are saying, that they are being victimized by other people. Okay. So you should be able to differentiate between people who are truly being victimized, who are just whining. Okay. Because self pity and whining will not make things better. If you're pitiful and if you keep on whining, like, I mean, it won't change your situation better. So as a helper, we need to respect clients' negative experiences and also to help them move beyond them. We don't discount it. Okay, but at the same time, we need to help them move beyond that. Just being victimizing oneself, it will not help. Okay, like as I said, experiences are used. When you listen to experiences, this is what you try to understand. Like experiences would look like this sometimes. So experiences like the economy is picking up, but the kinds of jobs I want are already taken, so I cannot do anything. It's a passive thing. I can't do anything. No innovative, creative teacher gets very far around here, so I cannot get. So it's a pessimistic view. So in your experiences, you're talking about it. And in thoughts, like for example, point of view. This is an example again taken from Egan's book. This 80-year-old lady is telling to the counselor, my sister in Port Elizabeth, who is 85 years old, we call her sister. She is very ill. She's probably dying, but she wants to stay at home and spend her final days in the comfort of her own house. So she has asked me to stay at her house and to take care of her. I think that she's asking too much. That's asking too much to ask me. I could use some help myself these days, but she keeps calling me. Okay, what is the point of view here?
That she feels her sister is asking too much from her.
Yeah, it is too much from her. Okay, and sister's point of view is, so from her side it is not right, whereas from sister's point of view, like whatever happens to other people should be there. That's what the sister is thinking, right? And from this person's point of view, that it is not right to ask. You're getting my point? Is it
Yes,
clear?
yes, sir.
Okay. So one reason that some clients fail to manage the problem situations of their lives is that they are too passive or see themselves as victim. Okay, like these people are doing this situation, this government is like this, my family is like this, society is like this organization is like this. Okay, so that is seeing, and they feel like they are being controlled by external forces, also internal forces. I cannot control this. Okay, it is coming up quick on its own. Those kind of things, you will not discard them. You will not put them down, but you will start to understand where the problem lies. Okay, at a later stage, you will help them to gently confront them, gently challenge them there, not in the initial stages. But you will do that with respect, utmost respect. You confront them. You help them uncover this. Okay, so that is one reason. And so what you need to listen, as we have already seen, you need to listen to thoughts, feelings, experiences, points of views. Okay, so sometimes you can be just, if you are not really attentive, you can be superficial listener, or you will listen to what you want to listen to. Okay, so you need to ask yourself, am I a superficial listener? Am I a selective listener? Am I fully attentive? Okay. So if client is taking a victim role, sometimes you can help them cope with victimization. Like, my husband is beating me so much, so husband is saying these things. We can help them cope, but if you want to fully manage their problem, sometimes like setting itself has to be changed. Maybe court has to intervene and end that relationship. Okay, but we can help them to the extent what is in their capability, that you can help them to manage those things. Okay, so as we can see, listening can be to words, feelings, and body language, and it is also important that you take context into consideration. So we have already seen these are the things that we are going to look at, right? Okay. So now we have seen like how we can attend visibly tuning. Then we have seen like solar. We have seen listening. Active listening that we have seen. Probably the next skill that we are going to talk about is empathy or empathic listening. Okay, so that is, it's basically empathy involves understanding and connecting with other person's inner experiences, emotions, and perspectives from their point of view. Okay, it means immersing oneself in the world, in other person's world, without passing any judgment. You don't pass any judgment. You might identify that, okay, this is not helpful, but you will still hold that. Okay, so empathy allows us to share in someone's feelings and see the world from their point of view. Okay, but it is very, very important, even though you understand them fully, okay, by being in their shoes, it becomes unfruitful if it is not communicated to them. You think that I understand, but other person doesn't know whether you understood or not unless you communicate to them. Is it true or not? You tell
Yes.
yourself, I understand, but the other person doesn't know until you communicate to them. Right? This is what you are saying. This is what you are feeling. Am I right? Okay, then says, okay, yes, you got it. Now that the client feels they are understood. Is it clear? So understanding is unfruitful if it is not communicated. Is it clear? Okay.
Yes, sir.
Yes, sir.
So, so probably tomorrow we will talk about basic empathy, and we will do some exercises. So in order to respond empathetically, first you need to listen empathically, then understand empathically, then once you understand, it leads to empathic responding. So listening leads to understanding, leads to responding. Okay. So in the next session, we will talk about how we actually show empathy. Okay. Uh, so if you have any questions from what we discussed, you can ask me. We have just 6 minutes left. Did you get something out of today's session? Did you understand things?
Yes, yes, sir.
Yes, sir.
Yeah.
Yes, yes, sir. It's very interesting actually.
Mhm.
Sir, can we record the session in order to ensure that we are not missing out anything, or
It is
because
available on YouTube, right? They are streaming in YouTube. You can go
no,
back
no,
and
not
watch it.
this. When we are involved in a counseling session with the client, do we record a session
Yeah. You
to?
can. But only thing is you need to seek consent from them. You need to
Okay,
let them know that you are going to record.
okay,
Sometimes my clients, they themselves would record because they want to go back and process it.
yeah,
Sometimes it is too heavy for them to process.
yeah.
They ask me, okay,
No,
can
because
they
we can
record?
miss out some nuances here and there. So maybe if we replay it or something like that, because you said we
Yes,
miss out some cues in some non-verbal communication.
yes. So when you're like in abroad, when you're like probably it's not practiced here. In abroad,
Okay,
you have to record few video sessions
okay,
and get them rated by some supervisors. Only if you cross certain number, certain point, let's say on a 10-point scale, only if you cross 7, then only you will be allowed to go into next stage.
okay,
Okay. So right now I am taking supervision on one particular therapy. Okay. So I need
okay,
to take supervision for 40 hours.
okay.
Okay. For almost around 30 sessions I need to take. So my supervisor is in Netherlands.
Okay.
So
But is
once
this
you
really
reach,
practiced in our country?
see, it's whether it is practiced or not. If we do that, it is we will develop our skill.
Yeah,
That is helpful for skill development. So there are no rules and regulations here, like which says that you have to practice. But if you do, it is practice. But at least in here we write our notes, what kind of a conversation that we had with the client, we write it. What the client said, what I said, what
yeah,
the client said. We write verbatim. Then
yeah.
we
Notes
process it.
they take, yeah, that we have seen.
No, notes, it's not the summary, but the verbatim. We call it verbatim.
Okay.
Therapist said this, client said this. It's the transcript.
Oh, okay.
Yeah. So when practicing micro skills, you have to have 10-minute conversations where you need to write all those 10-minute conversations and show it to your supervisor. Okay. Whether you have shown empathy, whether you missed the chance of showing empathy, whether you are evaluate, you are judgmental, and all those things that would happen there.
So wherever it is, whenever you start practicing, I mean, you start a
Hmm.
counseling session, you need to have a supervisor.
It is good to have a supervisor
Okay.
because sometimes we don't be we I, mean, I might think that I know everything and I'm right. Okay, when you talk to somebody only, you will look at your blind spots.
Okay.
You will get new perspectives.
So in this regard, sir, it is out of the course. Do you
Hmm.
provide any internship or any hand holding or like a supervisor to any students?
So I mean, I have few students, like 2, 3 students only, where
Okay.
it's not through the organization where I'm practicing, but they
Okay.
contacted me. I know them because I've taught them. So they
Okay.
contact me. I provide supervision for them.
Sure. So can we also do that, sir?
Yeah. Once you start practicing, once you have clients, we can have that supervision.
No, even before practicing, we just wanted to have some internship kind of thing because directly getting into a setup sort of thing. So I personally think maybe we can do with a senior something like that, like how junior doctors do. So in
Hmm.
this psychotherapy also, can we do that?
See, you can do that probably, but again, in private practice, it is little difficult. The reason is like let's say client also should agree
Yeah, client
for
also should agree. Yeah.
yeah for others to sit there.
Okay.
Okay. So if they agree, then that is fine.
Okay.
Yeah.
Thank
Sir, a
you.
small request.
Yeah.
Sir, I will not be able to attend tomorrow's class.
Hmm.
Is there any way to get your lecture or session tomorrow? Day
No,
after?
they are it's live streaming, right? It is there in YouTube.
Okay, sir.
Yeah. So they are there in YouTube.
Okay, sir.
Yeah.
Thank you.
So you can go back and always listen to them.
Thank you, sir.
Yeah. Okay. So any other questions? So I'm not talking about all the theory that is there in your book. I'm talking about the important skills that we need to have so that you can start with counseling. Okay. Like theory you can read by yourself, but if you know really what happens in the therapy session, that is really helpful.
That's what is going very interesting, sir.
Okay.
Your class is very interesting. That's what only. It's
Yeah.
but anything after listening also, it's not that much easy to deal with a client.
Yes.
Opening up is not that much easy. That client that much not easily open up for
Yes.
new to this field. No?
Clients also, they test us.
Yeah.
Okay. First, they reveal some less important information. They see how you are responding, how your non-verbal behavior is. If they get that trust, then only they will reveal deeper issues. So, like, if you are genuine, you don't have to worry about all these things. If you're not genuine, they can easily pick up. But again, like most counselors who practice, like after some course, they just take the mode of just advising, suggesting. Even a lot of psychiatrists that are practicing, they just go into advising mode. You do this, do this, do this, do this, do this.
That's very bad, actually.
That's the practice. It's out there. Okay, like there is some place for directing, but we need to respect the person's capability to help themselves. Okay, we need to bring out their own strengths. Okay, so I think time is done. So thank you all of you for your patient listening, and we'll meet tomorrow.
Thank you, sir.
Thank you very
Thank
much
you, sir.
for your class, sir.
Thank you, sir.
Thank you.